Nasal bones are paired facial bones forming the dorsum of the nose. It is a type of flat bone. Parts of the nasal bone. Nasal bone has two surfaces, outer surface and inner surface, and has four borders: superior border, inferior border, medial border, and lateral border. Determination of side can be done by 3 points. Outer surface is convex from side to side. The medial border is slightly bent inwards to form the nasal crust. The inferior border is notched. External surface is convex from side to side. Internal surface is concave from side to side. Internal surface presents a groove called as anterior ethmoidal groove. The anterior ethmoidal groove lodges the anterior ethmoidal nerve and anterior ethmoidal vessels. External surface and superior nasal cartilage, also called as lateral nasal cartilage, gives origin to procerus muscle. Superior border articulates with the nasal notch of the frontal bone. The lateral border articulates with the frontal process of maxilla. Medial border is slightly bent inwards and it articulates with the medial border of the nasal bone of the opposite side and forms a crust called as nasal crust. This nasal crust articulates with the nasal spine of the frontal bone and the perpendicular plate of the ethmoid bone. The inferior border is notched. It articulates with the lateral nasal cartilage and the notch is converted into a foramen. The foramen transmits the external nasal branch of the anterior ethmoidal artery and the external nasal branch of the anterior ethmoidal nerve. Nasal bone fractures are common. Nasal bone fractures leads to flattened nasal bridge, a saddle shape of deformity, widening of the nasal bridge, epistaxis, edema, tenderness, and crepitus in the region.